As we look at the JAK2 inhibitors in 2013, I think they're really in two different places. First, the data that we really know about their use in myelofibrosis. For the large part, both the approved drug of ruxolitinib as well as several that are well advanced in development, pacritinib, CYT387, and SAR302-503, they've for the large part been tested in individuals with more advanced myelofibrosis, fairly significant spleens, symptomatic, higher risk individuals. In these groups, we clearly have found these drugs are beneficial. Ruxolitinib was approved and is effective at decreasing the size of the spleen and symptoms, and likely has a survival advantage from what we've seen from the randomized phase 3 trials. I suspect that the phase 3 trials from SAR302-503 and the subsequent trials from CYT387 and pacritinib will all be beneficial in the same group. So I would say that in 2013, clearly that is the main benefit that we know of for certain individuals with advanced myelofibrosis. The areas that we don't know that are more exploratory are whether JAK2 inhibitors earlier in the therapy of myelofibrosis will be helpful. Will it help to prevent progression of the disease? I think it's less certain whether we know how much these drugs can help to improve anemia. CYT387 may have a benefit for anemia, and phase 3 data would be very interesting to see from that drug. As we look at earlier disease, there are phase 3 studies ongoing in polycythemia vera based on the phase 2 data showing that ruxolitinib was beneficial for decreasing the need for phlebotomies, improving symptoms, preventing vascular events in patients with P. vera. I suspect that there will be a role for JAK2 inhibitors in P. vera, in particular with those more problematic disease. There's activity in ET. The data with ET is probably the most limited at this point in time, but the potential to, in particular, help control platelet counts in individuals with more advanced or symptomatic disease will be interesting. So I think in MF it's pretty clear. I think in PV and ET it's an evolving story.